Hi, welcome back to my channel. In this video, I will be talking about the drugs for gout. So, first of all, you should know that the gout condition, it basically arises due to the accumulation of uric acid, and uric acid is insoluble. All right. So now we will classify it into two types. One is the treatment of acute gout, and then is the treatment of the chronic gout. All right, in acute one, the first one is NSAIDs. Now in NSAIDs, you need to remember 2 points, which are that basically we prefer indomethacin, and aspirin is not used because it increases uric acid in plasma. All right, and tolmetin is not effective. All right, then second line of drugs which we use are the steroids. All right, now in steroids you can give an interarticular injection. Then coming on to the third one, which is the colchicine. Now the mechanism of action of colchicine is that it basically inhibits the microtubular formation. So it inhibits the migration of inflammatory cells to site of pathology, and inhibits the release of inflammatory markers. All right, and you can remember side effect as diarrhea. All right, then coming on to the chronic treatment. Now in chronic treatment, you need to know that you can do it in three ways. All right, so the first one is basically, this is the reaction in which xanthine gets converted into uric acid by the action of xanthine oxidase. All right, so this is the basic reaction. Now the first mechanism of treating chronic gout is that you can block the synthesis of uric acid. Now how you will do that is by inhibiting the xanthine oxidase. So basically we have xanthine oxidase inhibitors. Now here there are two types. One is purines and second is non-purines. Now in purines there is allopurinol, and in non-purines we have febusostat. All right, then coming on to the second mechanism. In second mechanism, you will increase the metabolism of uric acid. Now the uric acid, it is basically converted into allantoin, which is a soluble form. So this is insoluble and this is soluble, and this reaction takes place with the help of enzyme called as urate oxidase. Now this enzyme is only present in birds and it is absent in humans. So basically we give recombinant urate oxidase analogs. So we give recombinant urate oxidase. Now in this we have two, which is rasburicase and pegloticase. All right, then coming on to the third mechanism. Now in third mechanism we can increase the excretion of uric acid. So here basically to increase the excretion of uric acid, we will basically decrease the reabsorption. Right, now to remember these ones, you need to know a simple mnemonic which goes by possible. All right, so P probenecid, S is sulfin pyrazone, then B benz bromarone, L lesinurad, and by L you can also remember losartan. All right, now a few extra pointers. Now the allopurinol hypersensitivity reactions have a predisposition to HLA-B5801. Okay, then you have to know that these are given IV. All right, then uh, allopurinol plus stibogluconate can be given for treatment of Kala Azar. Now, allopurinol, see this febuzostat is no dose adjustment required in kidney patient, but in allopurinol you require. All right, then there is one more criteria also that you should know, just for sake of knowing, that is uricosuric drugs should not be used if creatine clearance is less than 50 milliliter per minute, if there is history of nephrolithiasis, or if there is evidence of overproduction of uric acid. So these are the drugs that are used for this gout. There is one more thing, that 6-mercaptopurine and azathioprine, they are metabolized by xanthine oxidase, so the dose is to be decreased when given with allopurinol. So these are the drugs used for treatment of gout. If I made this easier for you to understand, do subscribe to my channel, give the video a like, and